the today's session is Enterobius vermicularis. Enterobius vermicularis is a tiny worm that lives in the intestine. So the disease caused by Enterobius vermicularis is enterobiasis. The common name of Enterobius vermicularis is threadworm, pinworm, and seedworm. Geographical distribution. Mostly it is seen in cosmopolitan worldwide distribution, especially it will affect the children. Mostly the Enterobius vermicularis is seen in cold and temperate regions. Next one is the habitat. Mostly it is seen in the cecum, vermiform appendix, and adjacent portion of ascending colon it is seen. Next one is the morphology of adult worm. The adult worm is small and white in color. It is more or less spindle in shape. In the anterior extremity, a pair of cervical alae is present in the adult worm. In the adult worm, the esophagus is dilated. The male worm is 2 to 4 millimeter in length. Posterior third of the body is curved and it is sharply truncated, and it will die after fertilizing the female. The female worm is 8 to 12 millimeter in length. Posterior extremity is thick and it is drawn out into a long tapering and finally pointed tail. The female worm will die within 2 to 3 weeks. Next one is the egg. The egg is colorless and it is asymmetrical in shape. It is surrounded by transparent shell, and egg is transparent shell contain coiled tadpole which looks like larva, and the egg will float in saturated solutions of common salt. Next one is the life cycle of Enterobius vermicularis. In Enterobius vermicularis, there is no intermediate host, only natural host is present. The natural host is man. Mainly, the man will acquire infection by ingesting the embryonated egg by means of contaminated fingers. Usually, the egg is seen in the perianal region. In that perianal skin, it is seen. Then it is swallowed and catch out in the intestine. From there, it will molt in ileum and it will enter the cecum. And in cecum, it will mature into adults. It will take two weeks to 2 months from the time the eggs are ingested. The development of the gravid female will ready to lay eggs. From there, the gravid female, it will migrate down to the column to rectum. At night, when the host is in bed, the worm will come to the anus and it will crawl in the perianal region, and the egg will stick in the perianal skin, and the worm will retreat into anal canal and it will come out and lay more eggs. The female worm will may take place in vulva, vagina, and uterus and fallopian tube, and the female worm sometimes it will reach in the peritoneum. The male worm will not migrate. It will die after mating, and the male worm will pass in fecus. The female worm will die after crushed by the host during scratching. The female worm is seen in the fecus. The egg are infrequently found in the fecus, and female worm will mostly the female worm are seen in the perianal area, not on the rectum. The gravid female worm the crawling that it will lead to pruritus, and the patient scratches the affected perianal area. The patient have eggs of Enterobius vermicularis on fingers under the nails that will lead to auto-infection. The pathogenicity is seen in auto-infection. Auto-infection means the infection occurs from anus to mouth. In retro-infection, the mode of infection occurs from anus to colon. The auto-infection is more commonly seen in children. In auto-infection, it occurs by ingestion of eggs due to scratching. The egg will be seen under the nails. Due to ingestion, the auto-infection will occur. In retro-infection, the eggs will enter from anus to colon. Through backward flow, it will occur. Next one is the clinical features of the Enterobius vermicularis. Mostly the Puritis ani is seen. The worm will curl in the perianal area and lay the egg, so it will cause pruritus due to continuous itching. It will cause eczematous condition around anus and perineum. Sometimes salpingitis, inflammation of fallopian tube is seen as the worm will migrate to the night and it will disturb the sleep. So nocturnal enuresis is seen in sometimes. In most of the cases are asymptomatic, and the worm will curl into the vulva and the vagina, and it will cause the irritation and mucoid discharge. Sometime in the surgically removed appendix, and it is responsible for the vermiform appendicitis. Next one is a laboratory diagnosis. Laboratory diagnosis is done by detection of egg and detection of adult worm. Detection of egg is found in under fingernails by NIH swab method and Scotch tab method. Mostly the detection of egg, usually in fecus the egg is not present. Mostly the egg is stick towards the perianal region, so the stool examination is not useful for the diagnosis of Enterobius vermicularis. In NIH swab method, it is used for the collection of specimen. The NIH swab method, it consists of glass rod at one end. That glass rod that contains a piece of transparent cellophane which is attached with a rubber band. The glass rod is fixed on a rubber topper and in which the white test tube is kept. The cellophane part is used for collecting the swab rolling over the perianal area. It is returned to test tube and it is sent to laboratory for the confirmation of the diagnosis. Next one is the Scotch tap method. In Scotch tap method, it is also used for collection of specimen. Scotch tap means a tap-like method which is held sticky out on a wooden tongue depressor. It is placed firmly against the anal margin. It should cover all sides. Then that tap is transferred to glass slide, sticking the side down, and a toluene for clearing solution is poured and it should be examined under the microscope. Next one is the detection of adult worm. Mostly the detection of adult worm is found in crawling out the anus when the children are sleeping, and it is detected in stools after collected. In enema may be seen in appendix during appendectomy. It is seen. Next one is the preventive method for Enterobius vermicularis. Maintenance of personal hygiene is important. Maintaining hygiene such as frequent washing of hands, fingernail, regular bathing is needed for maintaining Enterobius vermicularis. Frequent washing of night clothes is needed. Thank you.